Go.
Hello, our fourth factor in dealing with atopic disease is of course the use of antibiotics. Now, as a converse of the steroids that we talked about yesterday, I would say that often I feel that we don't use enough antibiotics and we use too much steroids. In fact, steroids will often hide infection for us, so if we're using steroids regularly, we may not be aware that there are those infections out there. And I think, especially when I look at cases referred to me, quite often one of my criticisms would be that not enough antibiotics are being given at the right dose for long enough. So I'm always wanting 3 to 4 weeks worth of antibiotics. Choose an antibiotic such as a cephalosporin or a potentiated amoxicillin that will actually work against our bacteria that we find most commonly. That's Staphylococcal pseudointermedius, a recent name change from the Staphylococcal intermedius that you may all be aware of. So do be aware of the need for antibiotics. If you are going to treat at the correct dose and treat for long enough. And if you get in with antibiotics early enough, I think sometimes you can prevent a dog that has a tendency towards atopy from going into full-blown atopy. So antibiotics are very, very important, and I would ask you again to make sure that you're giving them at the right dose for long enough. I'm going to finish this series tomorrow by talking about intradermal skin vaccines, and I will give you the link to the webinar that I did recently, which is all about atopy for those who want to learn some more details. Thanks very much, and I will speak to you soon. Bye bye.